Richard Lazarus's stress, coping, and adaptation theory originated as a behavioral science theory in 1984, but was borrowed in nursing for enhancing the knowledge of nursing and improving the practice. Because of the continuous relationship between the individual and their environment, stress, coping, and adaptation theory is considered a transactional model. Where Sell-I's general adaptation syndrome describes and explains the physiologic responses to stress, Lazarus and his stress, coping, and adaptation theory focus on the psychological responses to the stressors we encounter throughout our lives. Lazarus and Folkman defined coping as managing demands, both internal and external, which are causing stress to the individual by changing thinking and behaviors to adapt to the situation. Lazarus describes his theory as process-oriented. This process-oriented look at stress shows not only what the individual thinks and does in a stressful situation, but also how their thoughts and actions might change as they move forward within the specific encounter. They describe two main factors in this process. The first being the relationship between the individual and the environment, and the second part being the stages of appraisals. According to McEwen and Wills, the person-environment relationship is made up of many parts, which can include the personality, values, beliefs, commitments, cultural and social components of the person. There are three appraisals: primary, secondary, and reappraisal. Primary appraisal is the initial reaction to the stressor and evaluates the situation. In this phase, it is determined whether it should be of importance to the individual. When the person determines the situation to be important or a threat, they move into secondary appraisal. This is how the person responds to the stressor. In this stage, the individual works out how they can deal with the stress, whether through internal factors such as inner strength or external factors like a support group. When the situation changes due to our adaptation or other factors, reappraisal comes into play as the person reassesses the situation and how to deal with the changes. Throughout my findings on this theory, the concepts are defined well and describe what people go through in their thought processes when encountering a stressful situation. The theory explains the processes we go through and what happens when the stress is unresolved with our coping strategies. When coping with these situations, there are two types of focus offered by the theory. The first is problem-focused, which is used when the person feels they can control the situation. This changes the relationship between the person and the environment. Emotion-focused coping is what is used when the individual feels they have no control over the stressor. McEwen and Wills describe this as changing the meaning of the situation to the individual. The connections made by Lazarus in the theory are easily followed, and the basic building blocks are clearly defined and explained. Essentially, people cope with the stress they encounter in their lives based upon the situation, their own personal internal forces, and the environment around them. No two people will deal with stress exactly the same because we are all individuals and have varying backgrounds and support systems, both internal and external. When looking at the progression, we can see that the model can clearly be clarified for the learner to follow and understand. One can easily see the steps when coping with stress and what happens in each step when you look at the model shown here. Primary appraisal is the judgment of the situation. Secondary is the process of making the decision on what to do with it. And reappraisal is when you look at the decisions you've made and decide what the next step will be. You are either able to cope with the resources you've used, or you cannot, at which time you would reevaluate and try to find a new coping mechanism. The outcome desired would be adaptation, which is defined as the ability to not only survive, but to flourish following a stressful situation. The inability to successfully adapt would leave an individual in a perpetual state of reappraisal of the situation, potentially leading to negative coping mechanisms such as alcoholism, anger, or avoidance. When it comes to current nursing practice and interventions, this theory certainly stands its ground. Nurses see the stress in our patients' eyes every day we practice, whether due to a new diagnosis or a chronic condition. Stress is a daily part of our lives in many ways. Some of the stress can be controlled, such as the patient with bronchitis who is still smoking. While this person cannot control the current bronchitis, which is certainly a stressor, they can make an effort to quit smoking, thereby controlling future episodes and susceptibility. Nurses can take the time to sit with this person and assist them in finding the tools to take control of their lives and manage the problem. An example of emotion-based coping in nursing would be a 35-year-old female newly diagnosed with breast cancer. Neither the nurse nor the patient has any control over this situation, but they can work together to reduce the negative emotional state associated with this diagnosis. The nurse can help the patient find support groups in her area and even take a few extra minutes to sit with the patient in her room and hold her hand for emotional support. There are many ways nurses work every day following this theory in helping their patients and even in coping with the stresses of our day-to-day job. There are many research papers in existence which study the effects of stress on the health of our population, further supporting Lazarus's theory. There are just as many studies depicting the stress and the coping mechanisms available and used for individuals diagnosed with certain diseases and chronic conditions, from mothers coping with the loss of a child to family members coping with the progression of a loved one with Alzheimer's disease and the responsibilities which accompany this diagnosis. Stress and illness knows no boundaries, nor do they care about socioeconomic or cultural positions. What we do know is that people react differently to stressors based on their own personalities, social standing, cultural backgrounds, and the unique situation we find ourselves in. The stress, coping, and adaptation theory incorporates those differences into the theory itself, studying the ability to cope with a stressful situation and the process one goes through in order to adapt. In nursing, we deal with stress every day, whether the stress we are coping with is our own or belonging to a patient we have grown a connection with. Those nurses working in a hospital setting see patients through some of their worst times, whether it be a surgery or a new diagnosis of lung cancer. Nurses are the front line when it comes to helping our patients find ways to cope with the stress associated with their condition by giving them answers to some of their questions or just helping them to the bathroom for the first time following surgery. Nurses themselves also have their own stress to contend with while they are offering support to their patients. They can grow attached to a patient, having cared for them for a long period of time, and suffer their own loss when that patient passes away. They're also dealing with a short staffing, an abundance of patient demands, and short supplies at times. Nurses have to learn to cope and adapt to their career, with much time spent in the reappraisal phase as the situations, patients, and demands change. Hudson bases her coping complexity model on the stress, coping, and adaptation theory developed by Lazarus. She refers to the definition of coping as given by Lazarus and Folkman as using mental and behavioral efforts in order to manage stressful situations by way of actions, emotions, and thinking. These can be adaptive or maladaptive. Hudson further describes coping responses as cognitive, emotional, or behavioral. In her coping complexity model, Hudson takes the stress, coping, and adaptation model further by studying the various ways people cope with stress. She states the process starts with a stressor, which can be influenced by many factors, including social, cultural, and cognitive. Timing can also be influential in coping abilities, as well as the significance of the stressor and the personality of the individual. Essentially, Hudson built upon Lazarus's model by focusing on the coping mechanisms people use, allowing for understanding between adaptive and maladaptive processes. This is performed in order to teach better coping in order to encourage more adaptive coping in stressful situations. In their paper, Genetic Counseling, Stress, Coping, and the Empowerment Perspective, McConkey, Rosal, and Sullivan discuss counseling needs and benefits for those diagnosed with a genetic disorder. They used Lazarus's theory of stress and coping to assist in building a framework for genetic counseling. McConkey, Rosal, and Sullivan detail the theory of stress and coping and how it relates to genetic counseling by first defining stress according to the theory, which is the interaction of the person and their environment. Because the theory is based on the relationship and the changing processes of that relationship, the authors felt it was appropriate for use in the development of their framework. The theory of stress and coping allows for development of coping resources in order to obtain a feeling of control in the situation. This sense of control can lead to the feeling of empowerment in the client. McConkie, Rosal, and Sullivan feel that this empowerment perspective, used with the theory of stress and coping, provides the framework for the counseling model they are proposing in their paper. In the paper, The Adaptation Process Following Acute Onset Disability, an interactive two-dimensional approach applied to acquired brain injury, the authors discuss the theory of stress and coping by Lazarus and Folkman and its relevance to their new model following brain injury. Brands, Wade, Stapert, and Van Houten state Lazarus's model is a serial model, one in which the results of one cycle of coping can possibly be the starting point of a new cycle. Different stressors can coexist, but they do not believe this theory allows for concurrent appraisal and coping with more than one stressor, nor does the theory allow for an interaction of stressors when they are happening together, which occurs in brain injury patients. Due to these shortcomings, the authors have found no support for the use of this theory when studying brain injury patients. The goodness of fit hypothesis, which describes the ability to control the situation, does not work according to their research, as it only partially fits the situation in explaining the adaptation that occurs. While they discussed the overall value of the theory, they also found weaknesses in certain situations, such as brain injury. Ashker, Penpraise, and Salman, in their paper, Work-Related Emotional Stressors and Coping Strategies That Affect the Well-Being of Nurses Working in Hemodialysis Units, studied the stress that can impact nurses while they care for chronically ill renal patients in these units. The stressors they found that impact these nurses, obtained through literature reviews, include the intensity of the environment, the frequent setbacks in the physical and mental health of the patients, and the pressures of the job, such as resources being limited and any moral dilemmas they find themselves in. All of these components can have an impact on the coping abilities of the staff in these units. Ashker, Penpraise, and Salman used the Lazarus transaction model of stress and coping as a guide for understanding the ability of hemodialysis nurses to cope with the stressors of their job. A survey was developed for the purpose of their study using this model as inspiration in order to determine the coping methods of those surveyed, giving credence to the usefulness of this theory. The theory of stress, coping, and adaptation is a useful tool for evaluating the stress in given situations and determining the quality of the coping used. This can be used for studies in patient environments, such as those receiving genetic counseling, which is more along the lines of a psychology practice, or those patients in a surgical setting. As Ashker, Penpraise, and Salman proved, this theory can also be used in studying the effects and coping strategies of nurses in their work settings. This can be useful in helping to make the environments friendlier to new nurses and encourage more young students to study nursing. Showing our new nurses how we rely on each other to handle stressful situations at work and healthy coping skills will only help the nursing profession in the future. While there are many subsequent studies which either prove the validity of the theory of stress, coping, and adaptation, we have also seen areas where the theory has some weaknesses, as seen with the study of brain injury and recovery. One could develop further studies which take this theory further in order to either validate the theory in these situations or disprove the theory entirely in such events. As time goes on and more studies are conducted, the theory can be expanded for use in various areas of study, in psychology and nursing, as well as medicine in general. Coping with stress and finding ways to do so is a vital part of life and work. Studies performed on the ability and methods to cope in these situations can go a long way in improving evidence-based practice. We can use it to not only help our patients as they go through a stressful medical event, but also as a way to improve our own coping abilities through the stress of treating our patients every day.